I was given a call that we had a patient with a severe knee injury after a water skiing accident.
It was the last day up north. My college friends and I usually spend 4th of July up there. It was probably my 3rd or 4th time skiing that weekend. I was dropping a ski to slalom, and I didn't think anything of falling until that very moment. Because I was on the right ski, it was on top of the water, and so it caught the water as soon as I fell, and the blunt force of me falling left with the ski catching the water immediately popped my knee right out. I felt it. I mean, I heard it. I heard a pop. Well, I just screamed bloody murder. And we called the ambulance as soon as I got to shore, when we knew it wasn't just a little accident, it was a pretty severe one. We came straight to Bellin. That was one of my mom's requests. We wanted the best, obviously, for this. We knew it wasn't good. We didn't know quite the extent of it at the time, but yeah, we wanted the best care.
Emily sustained a knee dislocation, so the femur and tibia actually separated. She had torn 3 out of the 4 major ligaments in her knee, with the ACL, the PCL, and then the entire inside of her knee, including the medial collateral ligament, MCL, as well as the POL, which is part of the inside of the knee. Often when we see a patient with this bad of an injury, there will be injuries to nerves or even blood vessels, and this can be a limb-threatening injury for a patient.
I've never seen anything like it. You know, when somebody comes in and says they dislocated their knee, I think the assumption initially is that it's the patella or the kneecap, which is a significant injury by itself, but it's not this. This has the potential to be life-threatening.
Given the instability in her knee and some of the injuries she had, it was felt that we wanted to do this sooner rather than later.
The urgency that he had to get me into surgery and get this thing going, get the ball rolling, made me feel good.
We discussed a reconstruction procedure of her knee where we systematically rebuild each of these injured structures. This also requires a tremendous coordination of resources from the hospital, the surgical standpoint, the assistants, the rehab afterwards. So we were able to swiftly coordinate all of that, and a few days after her injury we were at Bellin Hospital doing this reconstruction for her. I often will tell patients that the success of a surgery I do is just as dependent on the physical therapy and the patient's effort and engagement afterwards, and from that standpoint it's been world-class for her.
I had PT the day after surgery here with Jessie.
It was actually hard to believe that she just had that surgery done, because I mean, you could tell she was hurting, but just having a conversation with her, I knew it was going to be a good experience in terms of the patient and her motivation. You're going to get what you put into it, and there was never pushing her. In fact, sometimes it was kind of had to pull the reins a little bit on her to make sure we weren't going too fast, but motivation was never an issue for her.
What you have to do in this recovery process is sometimes you just have to sit there, hype yourself up for a second, some good positive self-talk, and just go for it. That's kind of the mindset I took, is just like keep pushing, have the best mindset you can. Obviously there's going to be better days than not, and that's when PT and Shepet and family are there to like pick you back up.
I've gotten to work with the physicians hand in hand, so they're in the building, and when a patient can come in and they know, especially with something this complicated, they know that the doctor, the physical therapist, anybody else that we get involved in the care team is all on the same page. It just makes it that much easier for the patient, but also for myself, that the communication is clear, that I know exactly what the expectations are.
We really have the whole package here, so when you're coming to see us, you're not just getting the surgeon, you're getting an entire professional team. Having our therapy team right on site here just takes a lot of the stress away for the patient and allows them to feel comfortable that they're getting excellent care right in their own community versus having to travel an hour or two every time they need a follow-up.
I'm unbelievably grateful for the team here. It's been amazing. Dr. Shepet has been so wonderful. Even Jessie here, like I'll text him updates on where I'm at, and they're just like, that's so amazing. Like today when I told Dr. Shepet that I was playing pickleball, he was like with a brace on? And I was like, no. And he was like, that's so awesome.